I am Joyce Shira Cole, Ossining Village historian. I am conducting a telephone interview with Lindsay Farrell, President and CEO of Open Door Family Medical Center and Foundation. How are you today, Lindsay?
I'm wonderful. Thank you, Joyce.
Thank you. So I'm excited. Open Door is celebrating 50 years. Is that correct this year?
That's right.
That is exciting.
That's quite a milestone.
It really is. So first I want to start with historical background of the Open Door, like when it started, the mission, who started it, etc. If you can tell us about that.
I'd be happy to. So I was not here in 1972, but I've certainly, read lots of articles and meeting minutes and what have you. But it was a group of concerned local people that recognized the lack of health care in Ossining after the retirement of Dr. Hill, and folks living mostly kind of downtown here. After he retired, his office was on State Street. They had to go down to grasslands in Valhalla where there were clinics, and it was a hassle. Apparently, there wasn't one direct bus route. I understand that you had to take more than one bus, and they didn't really make appointments. You had to sit, you had to wait, and so as a result, lots of people just lacked access to health care. So this group of concerned local folks were able to engage practicing physicians in Ossining, Dr. Heckman being one of them, in establishing a free clinic in the basement of the First Baptist Church. And so that's what the group did. And the frequency of those free clinics, I think, started less frequently, so maybe once a week, but lots and lots of community members showed up, and so they realized they were on to something, and so they had to kind of up the schedule, and upping the schedule to 2 and more times a week just was hard. You need more volunteers. Clinicians had their practices where they worked during the day, and so generally the clinics were weekends and after hours, and it became apparent that a more permanent solution was indeed going to be necessary.
Okay, so they needed a bigger place. What was the second location rather? So it wouldn't have been the first. So what the second location?
Yeah, so I have this image. Now, what I neglected to say is that kind of the leader of the volunteers was the founder and my mentor, Marge Griesmer, whose husband, Jim Griesmer, was on the school board at the time. But she was a nurse, and so she was sort of the principal organizer. And I remember, kind of hearing stories. And I should also mention that the clinic was in the Sunday school of the First Baptist Church. And I always have these images of, patients sitting in little Sunday school chairs for first graders. And I think that's kind of funny. And I even heard that somebody brought their dog, and one of the and maybe we were even taking care of the dog as well. So there are lots and lots of sort of fun stories about the clinic, the free clinic. And I just have this vision of the Marge sitting in the little Sunday school chair, if you will, and looking out of the window of the Baptist church and seeing the empty Hilliker department store. And I don't know exactly when Hilliker's closed, but apparently the building was there and it was empty. And I have this vision of Marge sort of figuring out how she was going to get that building. And the great news is that, thanks to Marge and George Carter and lots of other, Nina Engel, lots of other, sort of local people, they realized that if they did some fundraising and had some philanthropic support, they really might have a chance of actually buying the empty Hilliker department store, which is ultimately what they did. And there was one gentleman in particular, and actually Agnes Murphy, whom I met when I got to Ossining in 1982. Agnes worked for a gentleman in Sleepy Hollow Manor, and Agnes encouraged Marge Griesmer and George Carter to go, have a sit down with this gentleman. His name was Martin Saunders, and ask him for money to buy the building. And he basically said, I'll give you the money, but you need to, do some significant local fundraising efforts, and I'll match whatever you can raise. So that was how we were able to come up with the funds to be able to buy the Hilliker's department building. And that happened in 1975.
Okay, so then we got the building. Is that when did the name Open Door become the name?
I think the name Open Door actually, was something that was created during the free clinic, during the days in the Baptist church. Okay. So I think that was, kind of what the group was calling themselves very early on. And it was actually, there were other volunteer groups that, kind of pitched in and gave some initial funding. The Junior League of Westchester on Hudson, provided a lot of volunteers in the early days. If you read some of the local articles, which I'm sure at the Historical Society, and actually, the Citizen Register, the paper at the time, which is part of the Journal News, had an office, and I think actually did reporting from here in Ossining. And so, there's a fair amount of coverage about this effort that was, taking place, and there was so much community momentum. So it was like really a good thing. It was really a good thing that was happening, and the only limiting factor was like space and then resources, because ultimately, they recognized that you just couldn't do what was necessary with an all volunteer effort, and so it became apparent that staff needed to be hired. And so Marge was actually the first person that was hired that got a paycheck, and they were able to write some grants, and I think it was the grants that ultimately was paying her salary, and then she was writing more grants so that she could hire a physician, and there were physicians indeed that were hired probably in the mid 1970s.
It's really fantastic. So when you think about it, the Open Door is such a staple, right? And it's hard for people that have been in Ossining most of their life. It's hard for us to drop Ossining off the front of that, even though you expanded so much, because we usually just say Ossining Open Door. But when talking to a lot of the people that are lifers in Ossining and what the Open Door meant, it was really more than just a clinic. You trusted all your clinicians. You went there for all kinds of advice. Even talking to my mother, she went for everything you could think of. I'm surprised they didn't block her number or stop her from coming in. She asked, I'm like, but you asked that of the clinician? So if we could talk about that, the demographic, how it looked when it first started, and then how we look today, the demographic change, the client change over the decades.
Well, I love hearing about your mother, and truthfully, Joyce, I mean, that's what attracted me, because, it's a special place, and the medicine that we practice, kind of is a little bit different from how medicine is practiced in a more traditional setting. But I will say that, yes, sort of back in the day, as I noted, we were serving a downtown Ossining clientele, which at the time was largely African American, and my gosh, I'm here almost 40 years. I've certainly seen that transition take place. As we didn't have a lot of Latinos early on. Now there were certainly some Latinos in the community, and we have some staff members who were here way back when, and I always say, oh, you were the first person from Ecuador. And so we had some Puerto Rican families, and so yes, there were a few Spanish-speaking families that were local and that were, receiving services at Open Door. But predominantly it was the African American community in the early days. And then, I've met so many people in my life in Ossining who say, oh, I went to Open Door, way back when, whether they were coming because their circumstances, they didn't have health insurance, or they had Medicaid at the time. They were coming because they just couldn't get the services they needed in the more traditional settings. And when people tell me that, there's always a, sort of a certain appreciation for, the role that we played and continue to play in the community. So I always love hearing those stories. And, people, they say, "Oh, were you at Open Door?" And they just love to sort of, share their experiences. And it really means a lot, because it's definitely, how I felt when I got here, when I was I started as a volunteer. And it was definitely that feeling that kind of lured me in and has got me here for so long.
To your point, the Ossining Open Door, when you talk about the stories of other people, they don't refer to it as a clinic. It was so much more. They didn't feel like when you watch a movie and they talk about a community clinic, it's usually subpar care and the facility doesn't look good. And that is like, it couldn't be further from the truth for the Open Door. You never felt like you were in a clinic, so to speak. You were well taken care of. Your clinicians knew your name, your children's name. They'll see you on the street and speak to you. So it's really a testament to what has been done over 50 years, that the community still feels like it's more than just, they still don't call it clinic, a doctor's office. You feel like you're just getting really good care there.
You're wonderful, Joyce. Yeah, thank you for sharing that. Yeah, I really attribute that to Marge. And I remember, she used to say to me, never use the word clinic. Mm-hmm. She really thought it was very pejorative. And I think you're right. I mean, a clinic kind of connotes a place where, there are clinicians who are learning and they're sort of experimenting or practicing. And, Lord knows, we certainly understand like the disparate treatment, particularly of, minority groups by the healthcare system. And so she was very, very sensitive to that and never wanted us to be labeled as a clinician. And she really, kind of carried that out in a number of ways. She felt very strongly about the caliber of staff that, we would hire. The clinicians, the providers that would be practicing at Open Door were, kind of top tier and, had the best credentials and education. She felt so strongly about that. And then also the facilities. And what was wonderful, and, I have to mention, the architect who actually was on the board at the time, and his name was Don Ryman, and he was from Briarcliff, a local architect with an office in Briarcliff, and his associate, Michael Molinelli, who, and Don and Michael actually did the former Ossining Public Library, if you remember it, before we have the new beautiful big Ossining Public Library. So, they had done a lot of, kind of signature work in and around Ossining and Briarcliff. And so they designed our facility, and Marge she always had a lot of rules, like you were never allowed to tape things on the wall. She really wanted it to be, a very professional and a very, dignified space for our patients and our staff to work. Our patients receive health care and our staff to work. So she had these very high standards about how the facility needed to be maintained. I feel like I've gotten a little bit more lax about that through the decades, but we really owe it to Marge, who really made that sort of a important aspect of who we are and the way we deliver care. So thank you so much for telling that, because it's important.
Yeah, and I'm feeling like Marge is reminding me of Helen Ward Potter, who was instrumental in bringing the Ossining Hospital, as well as a bunch of different other prominent people of the Ossining community. But they had the same kind of sentiment that just because they are of lower means doesn't mean that they should have less care. They should still have the best care. So they kind of both had the same spirit. So it's really nice to hear. So I want to talk about the progression of services over the years and partnerships, because when I was a baby, my mother went there. Actually, she went there for prenatal care. So she went for prenatal care. I was seen my entire childhood. My doctor was Dr. Guzman eventually. And when I had my children, I went back to Dr. Guzman
Yeah.
and I followed him everywhere. So it's
He was my kid's doctor too. He was such a character. He was a wonderful physician. Yeah.
really, and it's so, and it's because I kept going back. So, generationally for my family, and my kids are now adults and they're going back to the Open Door and they have different medical care and they were medical insurance, and they were like, but I want to go back to the Open Door. Will they take our insurance?
Oh.
So they really like it. So just, a story on top of that of what the Ossining Open Door has meant to a lot of people that were generationally going there for care.
And what I should say is, our model is, we're not a private physician practice, right? Mm-hmm. So we're a community health center. And so it's our job to, kind of weather the storm. So if providers move or leave for whatever reason, our job is to give our community, our patients, the assurance that, whoever is there to take care of them is top quality. And we really execute on that quite well. It's an excellent place to practice. We credential, the best physicians with wonderful training. And I think a lot of people don't really understand or appreciate that, right? Because they think if you're a community health center, you're taking care of people who need the sliding fee scale. And I don't think people appreciate, so the caliber of the clinicians and then all of the internal systems that we have to make sure that we're delivering the best care possible, right? So we have a tremendous amount of accountability in our system because of our public funding. And what our public funders want to know is that, we're delivering evidence-based care consistently, right, to our community. And so it's my dream, and that people really understand that and appreciate it. But, I think that most people think, well, healthcare is all about, oh my God, did your doctor go to Harvard, for example? And it's wonderful when, physicians are trained at excellent places like Harvard. That's part of it. But the other part is, do we have excellent systems in place to, really monitor the care and assure that it's being delivered in a wonderful way in an evidence-based way for our patients.
I was thinking as you were speaking, and it speaks to what you're saying. I'll tell you about one of your clinicians. Dr. Puthiamadan is on
She's excellent.
Everybody's tongue. And I remember my friend started going to her and she's like, you have to go back. You have to go to her. This has to be your doctor. And I could not get an appointment for a long time because everybody was fighting to get to Dr. Puthiamadan.
Yeah.
And then I finally got in.
She's double boarded, Joyce. She's double boarded. So she's boarded in internal medicine and she's also boarded in pediatrics. So, she doesn't have to sit for one set of boards. She sits for two.
Wow.
She is top notch.
She is
also tough. I mean, she tells it like it is, right?
And I think that for the people, a lot of people need it and want it. And when I did a street naming for one of her former clients, the family asked for her to come speak at the street naming ceremony. And I remember seeing her and I could hear all of the people saying, is that Dr. Puthiamadan? Like she was like Michael Jackson. So it was
she's fantastic, and we're lucky to have her. Yep.
Yeah, so it's just really a testament of the people that you're hiring, and how the community views the clinicians there. So people, I hope when they listen to this, really, one, try to get an appointment with Dr. Puthiamadan, but really understand what quality of care is coming out of the Open Door.
And, and Mary Rose, we call her Dr. Mary Rose, she practices in Sleepy Hollow, and where we have our residency training location. So we don't have family medicine residents in Ossining, but in partnership with Phelps, several years ago, it's probably more than 10 at this point, but several years ago, in partnership with Phelps, we established a family medicine residency program. And so Dr. Mary Rose Puthiamadan is a faculty member at the residency location, which is our Sleepy Hollow facility, which, if you haven't been there, it was built a number of years ago, and it took us a long time to get that facility stood up. But it's really a wonderful facility that's specifically designed to be able to accommodate physician residents, and so we have 24 residents in that residency program in Sleepy Hollow.
That's fantastic. So over the decades, the services provided at the Open Door has increased in number and I guess I want to say relevancy to the community. I remember being in when the pharmacy came, and then the condoms to teens program. That at first, parents were like, "Whoa." But then they realized the value in, if my kids can't talk to me, the Open Door realized that the kids need to be safe and protect them from STDs and, pregnancy. So if you could talk about just over the years, maybe even the pharmacy coming and all of the different programs and how they were instituted.
What I would say is that, one of the things that kind of upended our world, it was in the 1980s, which, you and I both remember was, HIV AIDS. And I would say that, the HIV AIDS, the good news was there was dedicated funding, and the funders recognized that funding, needed to be in the community. It needed to be at the community level. And so we are a recipient, and always have been a recipient, of Ryan White funding to make sure that, we are, number one, reducing, right, the incidence of HIV AIDS in our population. And, of course, back then, the medications just weren't as good as, it's amazing, how far the disease has come, the management of the disease has come thanks to these incredible medications. But, like, way back when, if you got HIV and you didn't, manage it appropriately, and there were tons of medications. You had to take like a gazillion pills, and that was very difficult for many people. And so we had all kinds of support devoted to, making sure that you understood your care plan, your treatment plan, that you had the medications, that you were taking the medications. And so in addition to the clinicians who, understood the science of the disease and the treatments that were required, we had lots of sort of care coordinator, case managers who could support these patients. And then, of course, we wanted to reduce the spread in the community, so we were doing a lot of prevention work, hence the condoms, right? And so, yes, of course, we're interested in family planning, but, back then it was HIV, which, basically, could be a death sentence, was a death sentence for many people in the early 80s. We've always had a commitment to family planning. There was a Planned Parenthood in Ossining, but it didn't, once we sort of got up and running, it didn't last that long because, rather than focusing exclusively on family planning, and like this is all we do here, we, practice comprehensive care. And so in many communities where we operate, Planned Parenthood, has basically said, oh, you guys are in town, we don't need to be here anymore, because they recognize, well, you're not going to show up on Tuesday or Thursday for your family planning clinic. You really want to be able to go at your convenience and know that your clinicians can provide what you need with respect to, your family planning needs. And so our model of, kind of we do it all, and we do it holistically and comprehensively, we think works really, really well, for patients, which is why people keep coming back, as you shared.
Yeah, the WIC program, the dentist. I love the wellness center. I ended up coming back to work for you in the wellness center as a dance teacher for fitness. You really have, I want to say Open Door has everything covered. But how do you come up with, it's not how do you come up with, but you guys are really tuned into what's going on with people and addressing it, even the wellness center, knowing, I know that there's a service with that, if you're diabetic, they talk about they have a nutritionist, and they also go and they work out in one of the many offered classes. It's really a full circle wellness, and they're taking care of everything.
I'm so glad to hear you say it. It was my dream. It's like my dream come true. And I was never a healthcare professional, if you will. I was never a nurse. I was never a physician. And so, when I got here, I was more in operations and administration. And so it was really, after 25 years, I had this incredible insight when we were really focusing on what do we need to, we really want to focus on prevention. We really want to focus on health. And kind of what I realized is our healthcare system in the United States was more of a sick care system. And so there was a real, shift that was kind of happening at the time. And this was, in the early 2000s that, we as healthcare organizations should be preventing people from getting sick. And so much of healthcare happens outside of the exam room. And so, what we realized was that we needed to really emphasize wellness and prevention. And sometimes, patients, might not need that pill, that prescription. Maybe the best thing that you can do is, take better care of yourself, get more sleep, up the calories that you burn, eat better. And so we wanted to introduce some of these programs as a very real part of our, medical programs here at Open Door. So we did a lot of work really just to kind of educate our clinicians. We really focused on nutrition, and we worked with Tulane Medical School that had, believe it or not, a culinary medicine program. And so, that was led by a chef turned doctor who was very passionate about just, eating better. And he recognized that, clinicians play a really important role in encouraging patients just to, put better stuff in their mouth. So we actually did a lot of training around that with our clinicians. And then, wellness center, it's not like we want to be a gym, right? We certainly, don't envision becoming Club Fit, for example. But we also recognize that, people didn't make exercise sort of a part of their regular routine. And so we might play a role in inspiring people to do that. And, we also wanted to dispel the notion that you need a lot of equipment to be able to, have a good kind of exercise regimen. So we wanted to introduce stuff that was like a dance class. How fun is that, right? And also reducing stress. So we had prenatal yoga classes and kickboxing classes and Zumba classes. And of course, all of that had to be put on the shelf during COVID, but the good news is it's coming back. And so our role is really just to inspire people, right? I mean, we just don't have huge big facilities, but maybe come check it out, see if you like it, and then figure out how to incorporate it into your daily activities. And I think it's worked. I really do.
It has. And just listening to you, Lindsay, the fact that you started as a volunteer and this was not initially your field as a nurse, and what you have been able to accomplish is quite incredible. Can you just talk about your career a bit?
Yeah, happy to. I mean, I think it was the hand of God that landed me in Ossining, and soon after I landed in Ossining, I was volunteering. I was actually, driving elderly patients who lived at the Life House, which is right down by the prison, and I was driving them to their medical appointments at the Open Door. And I would, come in, and my daughter was an infant at the time, and so I'd sit in the waiting room while I was waiting for them to drive them back home. And Agnes Murphy, whom I mentioned earlier, was one of the people that I drove, and sometimes I drove her to Mount Kisco for her Grey Panther meetings, which was kind of fun. But I just loved what I saw at the Open Door. I was just I'm wow, what an amazing place, and the energy was just so fantastic. So when the board of the Open Door at the time, said we're tired of doing fundraising, let's hire somebody to do it, I said, oh my gosh, I gotta get that job. And it was wonderful because it was a part-time job, and so Marge interviewed me and hired me, and it worked out really, really well because I was having my son Will at the time, but flexible work hours, and I just loved it. I just felt like I landed, and the fit was like fantastic. And then I just wanted to learn as much as I could. So, when you're responsible for, writing grants, you got to learn sort of pretty quickly. And there were lots of good teachers, and because we're a federally qualified health center, there was a lot of resources and support that I could look to. And so, like, in essence, I got my master's in public health without, sort of getting my master's in public health. And, fortunately, I was able to move into operations, and that was, ever challenging. Operations is really very, very hard. And then when Marge was, going to retire, I applied to get her job, and I was the internal candidate. But the board, I was successful, and so the board said, "Okay, there you go." So that was in 1999. I've been the CEO ever since, and I just feel like I have the best job in the world, and I'm like the luckiest person in the world to be able to live and work in your community. Is there's just nothing like it. It definitely has its challenges, but by the same token, it's just incredibly rewarding. So I feel very, very fortunate that I just landed here. It was definitely the hand of God.
Yeah, and we are very fortunate to have you. And I always found that the best leaders are ones that work their way through, and you've been there so long. So, is there anyone that currently there that's been there longer than you?
Oh my goodness! Well, Evelyn Tan in our finance department, she and I started on the same day. Mm-hmm. So no, there's no one that's been here longer than me, because we have been here a really, really long time. But we've got many, many long-term employees, which is really pretty fantastic.
So this is wonderful. So we'll get ready to close out. I just want to talk about where is the Open Door now? What different communities are they in?
Oh my goodness, it's such an exciting time for us. I will say, again, sort of following up on the wellness theme, we recognize that so much of healthcare happens outside of the exam room, and so we're really focusing on our community partnerships. And of course, after the pandemic, there's so many behavioral health challenges out there. And so we see ourselves playing a kind of a larger role in behavioral health and, working more deeply in the community. We have a wonderful collaboration with Family Services of Westchester, who has restorative justice programs, one of which is actually sitting in the Ossining Police Department, where we have clinicians and peers who work alongside of the police, so that when the calls come in, they sort of figure out, well, who's going to be dispatched out? Is it a social worker? Is it a peer? Is it a police officer? Is it all three? So that's a really exciting program that we're doing with Family Services of Westchester. And I should also note that we see further work in the area of early childhood and child care through our partnership with Family Services of Westchester. We have Head Start programs throughout Westchester County that we're working, sort of very closely with. So that's exciting, right? So this, notion that, you really do, particularly if you're have some socioeconomic challenges or other vulnerabilities, you need resources, right? And so we see ourselves as being, one of the entities that's going to help you sort of, pull those resources together, because you can't really be healthy if you don't have a roof over your head, right? Or if your kids aren't well taken care of while you're off at work. So I think that's, kind of where our future will take us. That's not to say that, we are not equally committed on the medical side, but we recognize that a more holistic approach makes sense for, families, people with challenges. So I think that's what the future holds for us.
And I'd like to also add one of the services that I love. I remember my daughter called me in Ossining High School, and she wasn't feeling well. And I thought, I was like, oh my gosh, I have to leave work. She said, well, you don't have to leave, Mom. The Open Door is right here. You just have to give permission for me to be seen. And I couldn't believe it. for parents, that it's hard sometimes. I'm fortunate that I can leave a lot of times, but sometimes I can't. And it's nice that right in the inside of the school, you guys are seeing patients, seeing the kids.
Isn't it great?
It's wonderful.
I wish we would have had it when my kids were, in the schools. And I used to think, Open Door's right downtown and we're so accessible. But, what we've learned with school-based health, and we've been doing it for many years in Portchester, and certainly many years in Ossining, it's like the best place to be because not only, you're working with kids, and it's, certainly in the high school and in the middle school, it's like another trusted adult who can, be there to support your kids, right? But in the earlier grades, parents are so, they want their kids to be successful. And so we as clinicians in our school-based health centers can, just be involved in working closely with families. And, kids are in school 5 days a week, right? But we might see them in the health center 3 times a year. So we can do really, really impactful work. Again, focusing on health prevention, focusing on wellness through our work in the schools. And it's just been fantastic. So we're in Portchester, we're in Ossining, and I'm also proud to say we're up in a little school district known as Weebatuck, which is in Dutchess County. And, I expect we'll be in more districts as well as, school boards and parents understand the benefits, as you do, Joyce, of school-based health. It makes such a difference for working parents, but also in the, sort of the health journey of a family.
Yeah. And the kids trust you. I mean, the fact that, most kids, they want, when they're young, want their parent in the room with them. She wasn't nervous. She didn't ask me to come home. So it's really a testament, as I said before, to the work, the clinicians, what you're doing at the Open Door. So Lindsay, we really thank you for 50 years of amazing community care that continues to grow.
You're wonderful, Joyce. Thank you so much for interviewing me. I really very appreciate it so much.
Thank you. Is there anything you wanted to add before we wrap up?
No, you covered it all. You're the best.
Thank you, Lindsay.
Thank you for sharing your insights. It's very heartwarming to know that you're happy with the services that we provide. It means a lot.
Yeah, you're quite welcome, and I'm appreciative of the care. So thank you, Lindsay. I know this won't be the last time we see each other or talk to each other, rather. So thank you, and continue the fantastic work that you're doing.
My pleasure.
Okay, take care.
Thank you.